Hi, everybody. My name is Crysta Harris. I am a licensed professional counselor of mental health in the state of Delaware. I've been a therapist for the past, I would say, 5 years, but I have about 7 to 8 years of experience in the field. I work at a psychiatric private practice in the state of Delaware where I have clients that range from 8 all the way until 80. And I see children, teenagers, families, couples, and also I see individuals as well. Um, I have experience with trauma. That's one of my focus areas: trauma, family systems, family patterns, and how do we break negative patterns to live a more productive life. I also am the co-founder of Master Gurus. And so my business partner, Lakeisha Beatty, we created the Master Planner, which is a planner for, excuse me, students in undergrad that is looking to pursue a career in the behavioral health field. So it's a planner and a resource guide wrapped all in one. I also this year recently I just launched What's the 411 on Black mental health, which is a platform that highlights topics within the Black mental health realm. So that's something that just launched this May, actually.
Well, Krista, thank you so much for being on here. My name is Jeff Pinson. I'm also a licensed professional counselor of mental health. And today, Krista and I are going to be talking about some of the things that she alluded to, family systems and what that means in therapy, as well as what you look for in a therapist. Characteristics, race certainly plays a big part in that. And we're going to be talking about all of those things and how they play into the therapeutic process so that we can be better counselors and so that the clients can get more from that process. So thank you, Krista, for being on here, and I look forward to this interview.
Perfect, no problem.
So, Krista, one of the things that's very important in a therapeutic process is making sure that you have a good connection with the counselor. So one of the things, of course, that is the most obvious maybe is how the counselor looks. It could be any number of things: physical appearance, past experience, anything like that. So my question to you is, what factors should people consider when they're choosing a therapist?
So that's a really good question. I think it's a lot of factors to include, not just only physical features or characteristics. I think the first thing, kind of what you alluded to when you asked me the question, is number one is the relationship, right? I think that overall is the main predictor of how therapy is going to go and how you're going to function in therapy and how productive you're going to be and how much progress you're going to make, because that relationship is what really ties everything together. So besides the relationship, I think people should, when looking for a therapist, you want to have that connection. In order to get to that connection, you do look at other characteristics. So one thing that I tell people that are looking for therapists is, number one, to do your research, right? You can Google, you can use YouTube, you can use different platforms and resources such as Therapy for Black Girls, Psychology Today, those different platforms in order to find that therapist. The first thing that draws a person, and this is my opinion, that draws a person is how they present. What they specialize in, meaning do they focus on women issues? Do they focus on cultural issues? Do they focus on anxiety, depression, and things of that nature? So whatever the challenges that you are experiencing, you want to make sure that the therapist that you are considering, they have experience in that, or if that's their specialty. And then when looking for a therapist, yes, you want to, again, have a match. So then physical characteristics do come into play. So such as, like also what you were saying, as far as race, if you are an African-American or Black person, do you want to see another African-American Black person? And for some, because there's a history of African Americans and Blacks not trusting the process or not understanding the process, you to feel a little bit more comfortable and less apprehensive, you want someone, or you feel more comfortable with someone that looks like you, because you think and feel, well, they can understand my vernaculars, they can understand my experiences, they can understand, the different situations that I have been in, and it makes that relationship, come together a little bit more concrete. In addition to, race or what have you, also gender, right? Again, if you're a woman, do you want to see a female therapist? If you're a male, do you want to see a male therapist? And again, I think it's all about what you're comfortable with. And sometimes when you're a woman, you say, well, I want to see a woman therapist because, they can relate on topics that I'm bringing to the table or bringing into the room. Sometimes with a male, sometimes males want to see females, and I've heard that's because they say, sometimes maybe women can be like more understanding. So again, that's everybody's different, but that is something that I hear men say sometimes. Or yes, they do want to see another man because again, they feel like it's more relatable and that male therapist can understand the topics and the things that they're bringing into the room. And again, I just think it's all about being comfortable. I know other things to consider when you're looking for a therapist. You may have a strong spiritual background, so you may want to find a therapist that highlights that brings that into the room. Or you may be a person, again, that, you don't have a spiritual connection, or you're not as religious or what have you. So you really don't want to have that come into the room at all. And so what makes it important is you having that conversation, and that initial conversation, these are the things that you bring to the table. These are the things that you ask your therapist, whether you're doing a phone consultation or a face-to-face consultation. These are the things to ask and discuss with that therapist, just because you don't want to be uncomfortable. Well, let me back up. Going to therapy for the first time anyway can be nerve-wracking, and you can wonder like, well, what do I say? I don't know where to go or what to do. And so to kind of help ease that anxiety about the process, you want to go in feeling comfortable with the person that you're sitting across from.
Mm-hmm. Yeah, great answers. Thank you for that, Crista. You said a lot of really great things there, and I'm always glad to hear of new ways to connect with therapists. So you mentioned websites where specifically African American people can look for an African American therapist, and also on Psychology Today, the filters that they have, finding somebody of a certain race or gender or religion, spirituality, an alliance to certain things, somebody who's looking for somebody who's an ally to somebody who might be gay or bisexual, something like that. There's a lot of things available for people who are looking for something specific. Absolutely. So that Absolutely. They can get the help that they need. And like you said, feel comfortable with that too, and really develop that relationship that's going to be conducive to the therapeutic process. I love that. Yeah. Thank you for those answers.
No problem.
Yeah. So
I do want to highlight a couple of other platforms that I just thought off the top of my head. It's this website called healthinherhue.com. And that is a resource that I actually just came in contact with yesterday, actually. And it's a resource that helps you find not just therapists, but other like physicians or psychologists or psychiatrists. So I know that is also a platform. And again, it's called Health in Her Hue. Melanated Mental Health is also another one. Therapy for Black Men, that's also another platform. And again, you can Google these and it can lead you to the website and or their social network handles as well.
I'm going to include those in the description below this video too, so that people have more access to that. Obviously, that's important. People can be able to access these resources.
Yes, perfect.
Awesome. Cool, thank you. So that's a great description of what somebody should be looking for when they're looking for a therapist. We're gonna switch gears a little bit And you also specialize in family systems, in patterns and cycles, and what that means for the family. Because if people are complicated, a group of people is even more so. You know, a family and how you deal with those issues with more than one person, individually and also together when they're together as a whole. So, what are family patterns? You talk about family patterns, family cycles, family systems. What are they, and how do they inform the therapeutic process?
So this is the way that I explain it to my families or to individuals that I'm working with. I look at it as, or how I explain it is, it's basically a group of norms, right? It's just like how we function on a day-to-day basis. We function based on a group of norms, a group of rules, and that's how we live our day-to-day lives. So within a family system, that's your cocoon. That is your space of people, or a group of people that you know, that consists of family, consists of mom, dad, sister, brothers. That's your network of people, right?
Mm-hmm. Yeah.
And or even neighbors that help out, or grandparents, right? Because we lean on those people, and that's our tribe. That's our village, so to speak.
Right.
And so the way that you function is based on what was passed down to you, the things that you observe, the things that that you have been accustomed to. And so you operate in the way that you operate the way that your family usually function, because that is what you're used to. And that's what I mean about family patterns. It's this saying that I usually use, that although that's how you survive, that's how you live, or what have you, based on those family patterns that your family has set, or those guidelines that they have set. Mm-hmm. Sometimes those patterns, or those rules, or those norms are sometimes not conducive to the way that you currently want to live or need to live. And so when I'm in the room with a person, those are the things that we examine in order to say, hey, maybe what you were used to, or what the norm was for you, or what the family pattern was for you, that may not be maintainable at this point. And that's why you may be having some challenges, because you're operating in the way that your family or your village or your tribe has operated in. Yeah. Right. Yeah. And I explain it to my to the person that I'm in the room with, is that the reason why maybe your parents or your grandparents or other people in the family operated in this way is because that was the best way they know how. Like, that's usually a saying. Like, we did the best with what we had, you know, or they were surviving, or that's just what they believed was the best way, because that was passed on from their grandparents and whatnot. And so I'm all about breaking patterns that is not conducive to the way that you want to live, or the way that you should be living. And it's challenging because, again, sometimes people are really rooted in this, and it's hard to break away from that, because you don't want to feel judged. You don't want to feel like you are better than, or you don't want to, you know, be questioned of why are you doing these certain things if we've always been doing it this way. Mm-hmm. And so sometimes when working with my clients, it is very challenging for them, because, again, one thing I explain to them is, you've been operating in this way for years, right? So when we have a session or two or even three, those things that pattern that you've been operating in for years is not going to automatically break. Yeah. So my goal as the therapist is to bring, to highlight what the inconsistencies is, what the, you know, if there's incongruencies, and to help you and guide you to a way that you are able to live a more fulfilling life while changing and manipulating some of the patterns that you're used to.
Awesome. Everything you just said is so foundational to all the work we do as therapists.
Absolutely.
Not only with families, but individually. You know, like you said, the dissonance between what we want to do and what we're currently doing.
Yes.
As an individual, as a family, as a relational system, whatever it might be, and everybody that plays into that, like you said, neighbors, immediate family, extended family, friends, everybody that plays into that is probably just going to assimilate into that, and usually they don't realize it. They don't realize what I'm doing right now is not, it doesn't make sense, but I'm going to keep doing it because that's what I know. And you brought up a great point. We look back on our parents and how they grew up or how they lived, and it's easy to say, oh, they didn't make good choices, but they made the choices that made sense to them in that moment, based on what they had, based on what they were taught, based on the amount of money or resources that they had or the housing they had or whatever. So yeah, it's easy to look back and judge, but you bring up an important point. Obviously, we don't want to judge anyone, but we want to make them, we want to help them get to a point of better health. So that's awesome. Thank you for sharing all that.
One thing that I say to my clients and is a phrase that I use is, it's okay to unsubscribe to family patterns and systems. It's okay to subscribe to things that is not conducive to the way that you currently want to live. And that's how I usually phrase it to my clients.
Awesome. Yeah. So how do you get the clients to understand their own system? How do you get someone to understand what they're in right now from an outsider's perspective?
Well, it's, again, number one is the connection, right? I think without that connection, it's hard to highlight or to pinpoint any different inconsistencies, right? And when that person trusts you, it's a little easier for them to trust what you're saying and trust what you're putting out for them to look at. And so when I have clients, whether that's individual or families or teenagers or what have you, that when you point it out, it's almost like you go through different levels. The client goes through different levels. Like the first thing is, it's like usually like maybe defensiveness, or sometimes it's like shock, because when you point something out, they're in shock because they've been in it for so long. So when you're literally in the midst of the system or the pattern or the storms, so to speak, it's hard for you to see it's hard for you to see the sunshine. It's hard for you to see anything else, because that's what you have been accustomed to. Yeah. That's what you were used to. And so when I see my clients, I literally help them step out of that by drawing the inconsistencies, or we talk about the pros and the cons, or we talk about the functionality between what you're used to and how you're operating now, or what challenges are you having now. And I usually, because I do a lot of CBT in therapy, which is cognitive behavior therapy, which focuses on your thoughts and your behaviors and your feelings, and we tie that together. And I do a lot of solution focused therapy, so focusing on problem solving and focusing on the here and now and the present. So between I take different different treatments from both. And so one of the things that I do is I usually tie how my client is functioning now, and we connect that to how the family has been operating, or how conducive that is, or is it pros and cons with the behavior that you are presenting with, and why are you presenting with that behavior? And I usually always guide the client. Now I might push a little bit, but I guide the client to make those connections, because the more that they can make the connections, I believe the easier it is for them to start hitting that. I always call it the aha moment. Yeah. It's easy for them to, come to the aha moment and then say, oh, I didn't realize that, and start making changes.
Mm-hmm. It's important for that ownership. You can tell somebody something all day long, but if they don't understand it or take ownership for it, oftentimes it's in vain. That's a really good point.
Absolutely. And I do a lot of psychoeducation in my sessions. And I don't rush either. I do not rush my clients to get to the finish line, because like I explain it to my clients as well, I'm a visual. So I do a lot of, descriptions and pictures and whatnot. But the way that I explain it to them is, it's like almost if you have a deep burn on your arm or what have you, and the burn you really kind of need to go to the hospital, and you really need to get it treated. But instead, you just put a Band-Aid over top of it. what's going to happen with that? That burn is going to get bigger. It's going to get worse. It's going to hurt more. And so you have to take the necessary steps in order to treat that burn the correct way. And a Band-Aid or an easy fix is not the answer. So it's the same thing when I'm in therapy. I don't rush my clients to get to that finish line, because if I do, who's to say that they fully understood? Who's to say that they're going to be now invested, because now we've rushed the process? So that's something that I rely heavily on, is taking it easy and or slow in our sessions.
Absolutely. Yeah. So then last question, I think that ties it all up, and probably the point of most sessions: can families change their systems or their patterns or their cycles to a more healthy one?
So absolutely. For example, I work with many individuals from all walks of life and from different cultural backgrounds. And this one cultural background in particular, it's very rooted in like a patriarchal system. It's very rooted in the younger people respect the older generation, and not just respect as in how you communicate or what have you, but respect as in you shouldn't communicate your feelings because that's considered disrespectful. If you don't agree with something, if you speak up about it, that's considered disrespectful. And this particular background do not believe in therapy whatsoever, really. Not everybody, but overall.
Right.
And so I'm working with this family, and what I do is I praise any little step in the right direction. I do a lot of praising and show support and empathy in my sessions, because again, with deep rooted patterns, it is challenging, like I said, to get out of them. So any little step that you're taking, it's not even considered little in my book, because again, you are literally breaking away from something you have been rooted in for years, so to speak. Yeah. And so, again, breaking down and dissecting the patterns and showing the families how to live a more productive life, or productive, have a productive relationship. There has been significant changes in this particular family that I'm working with. And what I do, I don't put everybody together. Now we're doing telehealth, but I don't have everybody at the same time in the room. I don't have everybody at the same time on these virtual calls.
Right.
So I am very particular and very specific and intentional of who I pair together, meaning like if it's mom or dad, or if it's mom and daughter, or son and dad, or grandparents and the parents. I am very intentional of how I have these sessions. And it's needed to break the families up, because usually family members have their own way of doing things, and that is usually projected onto the family. So what I do is I break it apart in order to help and provide and give tools to each group, and then we come together. And so this one particular family, this is what I have been doing with them. I've been meeting with the daughter for a really long time and helping her be able to communicate and to express herself, because for so long she's been taught and told that if you do that, it's considered disrespectful. And so you have to think how that now looks for the client, my client. Now you can imagine it's hard for her to speak up in any area or any realm. And you can also look at the ramifications of that too. So if something happens to her bad, what's the likelihood that she's going to communicate it now? Now she's more so internalizing certain things, because her pattern or her family system has been, you don't say anything, you don't speak up because it's rude, it's disrespectful. And so then I have sessions with the mom individually, and we've been doing a lot of training and a lot of empathy work and things like that, so she can start understanding her daughter. And then I moved into talking with the aunt who is rooted in some of that system, but because she's been in America for so long, she, it's a conflict, it's dissonance, like you said. And so now I work with her individually. And so I've been pulling mom and daughter together, or I've been pulling the mom and the sister together, the aunt and my client together. And there has been significant change, and I make sure I praise that every chance and every step of the way.
That's wonderful.
I know that was a lot.
No, that's okay. It can't be. The importance of that cultural awareness cannot be understated. Like you said, there's a lot to it that is so deeply rooted, and oftentimes we don't even realize it. The way that I grew up, the things that were said to me, the things that I said, the relationship I have with my parents, with my extended family, with my siblings,
Absolutely.
that is the way that we see the world. And
Absolutely.
it takes so much to change that if it needs to be changed. And I imagine too that it's so easy to go back to previous ways, especially
Absolutely.
as you live with your family, spend time with them. These are things that take a lot of work, a lot of very intense work sometimes to change or to alter or to even understand, at the very least, just to understand them. So you're absolutely right. That cannot be understated. And the importance of that to change is it's all so connected.
Absolutely. One thing that, again, that I say to my clients is something that my supervisor, his name is Dr. Balin, John Balin, and he's an awesome supervisor, and he is the author of Brain-Based Parenting. He's my supervisor. And one thing that he highlights and he says is connection before correction. And so basically, what that means is that building that, again, the relationship with that child or with that parent or whoever in the family, building that connection before you go in and start altering or calling out things or highlighting behaviors that are not the best or correcting. And because if you go in that way, you are less to see a change, and you're less likely to see progress doing it that way. Right. But the more that you are invested and the more that you nurture the relationship, the easier it is then to see progress and change. And I operate that way with my parents and my families, and I do this for individual, and I operate that same way when I'm giving resources and tools and teaching my clients.
Awesome. Crista, those were some awesome answers. I appreciate your time. I appreciate your expertise. I appreciate the way you describe and how you work with families.
Thank you.
Yeah. So anybody watching, you can find Crista on Twitter, and you're on Facebook, I believe, as well.
Yes. So you can find me on Instagram at Crysta, CRYSTA.N.Harris. That's on Instagram. On Facebook, my name is Cris Harris, CRIS Harris, or Chris Nicole, I'm sorry, on Facebook, and Chris Harris on Twitter.
Nice. And I'll make sure that I include links or at least a tag on the YouTube, on the description for the YouTube video, however the best way is to link to that, so that people can find you and not only for your business, but also maybe following things that you might post or say or might be doing.
Yes, because I have
events
coming up for Delaware, so I have something good that I'm working to get out. So yeah, you definitely want to stay tuned for that.
Awesome. Yeah, check out those links and follow Crista, because she's trying to do some great things in Delaware, and I imagine probably trying to expand it nationally as well, if I had to guess.
Yes, I received that. I claimed that.
Yeah, there you go. There you go. Awesome. Crista, thank you so much for your time, and I look forward to talking to you again soon.
Thank you.